I welcome you all in our fifth session of our educational webinar. So far, we have exceptionally excelled and received overwhelming response from audience. We are delighted and we would like to continue the series as knowledge is the need of an hour. The COVID-19 vaccine was being approved and introduced around the globe with the hope the pandemic would eventually fade, but the scenario everywhere is same. Too many myths, fears for taking the immunization. With this note, let me hand over to our very own Dr. Sandeep Bhalla, Associate Vice President, ECHO India, to take the session forward. Thank you.
Thank you, Paramita. First of all, on this holy day of Eid, we wish very happy, peaceful, and safe Eid Mubarak to all of you. We pray for the safety and the good health of all of you. Today, again, we are continuing our educational series on COVID-19, which has been supported by SBI Foundation. COVID cases finally seem to be declining in India, but this might be because of slowdown in big cities. However, district level data shows a surge in small towns and rural areas. District-wise data shows rural areas now have a bigger share of cases in most states. More worrying than the reported cases numbers is the very high percentage of positive tests in the rural areas, which suggests a large number of cases are going undetected. The data also suggests that the COVID wave shifts from the city to towns, the underreporting of the cases increases. This is because the smaller centers do not do enough tests. India saw a record rise in the COVID-19 deaths. Yesterday also, if you see that it is more than 4,000. And if you see the number of the cases, it's around 3,40,000. As we are moving ahead, we have been hearing a lot about correlation between COVID-19 and comorbidities also. And one of the most common among them is diabetes. Diabetes increases the chances of infection and adds to the risk of getting those serious complications from COVID-19. There has been an overuse of steroids to manage diabetes in past 2 weeks, and there is a rapid rise in steroid-related diabetes in COVID-19 patients. Doctors are also now facing a rise in the cases of another deadly infection known as black fungus, technically called the mucormycosis, that appears to be mostly affecting diabetics who have recovered from COVID-19. While black fungus is not new, the pandemic appears to have created the perfect storm. Steroid use in diabetics with severe COVID can cause sugar levels to shoot up, necessitating a high dose of both anti-diabetic drugs as well as insulin. These patients require frequent blood glucose monitoring, good diabetes control. They should reach out to their doctors immediately. And if they develop the symptoms, they should, and they immediately, and if they develop the symptoms of diabetic ketoacidosis, like increased thirst, nausea, abdominal pain, fruity breath also. Today, to take this topic, we have none other than but a very globally renowned diabetologist, Dr. V. Mohan, Padma Shri awardee. Nothing best than him who can give us the update upon this particular initiative. And there are many questions among the people in their mind how to better manage diabetes during COVID-19. Can diabetes patients take COVID-19 vaccines or not? Does this make them more vulnerable and increase fatality or not? Dr. V. Mohan is the chairman and the chief of diabetology at Dr. Mohan's Diabetes Specialty Center. He is also the president and director of Madras Diabetes Research Foundation, Asia's largest standalone diabetes research center. He has published over more than 1,350 papers. Out of that, 8,878 original articles, trained a large number of physicians and diabetologists in addition to nurses and educators, in which I was a little bit involved with him in the capacity building arena also. He received more than 180 awards, including the prestigious Dr. B.C. Roy National Award by the Medical Council of India and Dr. B.R. Ambedkar Centenary Award from ICMR. First Indian to be conferred the Dr. Harold Rifkin Distinguished International Service in the Cause of Diabetes Award by the American Diabetes Association. Dr. Mohan has recently released his autobiography, Making Excellence a Habit, which is his main theme of his life. Everything what he does out of the way and with clear-cut guidelines and with clear-cut protocols so that excellence should come from that. The Secret of Building a World-Class Healthcare System in India, published by Penguin India recently, which is listed as a bestseller on Amazon India. On behalf of ECO India, that is Extension for Community Health Outcomes, we are really thankful to you for joining us and giving this update to all the healthcare professionals, those who are joined from the different nooks and corners of our country. Over to you, sir.
Thank you, Dr. Sandeep Palak. I'm very grateful to you and to Paramita Das and to others from ECHO India for inviting me to take part in this particular session. I would also like to extend my Eid greetings, Eid Mubarak, to all our Muslim colleagues all over India and other parts who may be listening to this program. Also, today is another auspicious day. It's Akshaya Tirtha. Very, very auspicious day for everyone. So I hope that this session will also be useful to you. Let me share my screen first. You can see it, Sandeep? Yeah, good.
Yes, sir.
I'll make it full screen. Yeah. Okay. So I noted that when Dr. Sandeep sent me the program, that almost every other day you're having a program related to COVID one way or the other. And so I'm very happy to join this elite group of people and talk to you on the subject of COVID-19 and diabetes. I'm aware that we cannot cover all aspects of this in this particular session, but if there are questions after that, please put it in the chat box, as Paramita was saying, and we can take that up at the end of the session. Also, for those of you who are, seeing us for the first time in this particular project, this is we are now collaborating. Dr. Mohan's Education Academy is collaborating with the Project ECHO and ECHO India, and we'll be. This is the first of a series of webinars which we will be conducting under the auspices of both ECHO and Dr. Mohan's Diabetes Specialty Center. All aspects of diabetes will be covered in this program, so you're all welcome to participate in this particular program. This is just to formally thank Dr. Sandeep Bala and the organizers. I have no conflict of interest to declare. Now, the first question that comes up is, are people with diabetes more likely to develop severe forms of COVID-19? I'm sure all of you know the answer, but I would like to give a little qualification to that and say, yes, if the diabetes is uncontrolled, probably yes. I do not know the exact number of my patients with diabetes who have developed COVID-19 because a lot of it is asymptomatic. But one thing I do know is that when we did the COVID antibody testing, we started that sometime in December, and started testing all our patients to see whether this before the vaccination was done. So it's not due to the vaccination. So we had a couple of months before that, in November or so, when we started doing COVID antibody testing of all patients who came to the clinic, new review, everyone. We just started doing COVID antibody testing, and we were kind of puzzled to find that 30 to 40% of all our patients were COVID antibody positive. About half of them knew that they had COVID. Some of them were treated for COVID, but the others did not even know, and they were so surprised when they had very strong COVID antibody positivity, showing that they have already suffered. So what has happened to them? They got the COVID and they recovered from COVID, and they had diabetes and they did not even know about it. So that's good news, that if the diabetes is controlled well, then they are not likely to develop severe symptoms. At the same time, the diabetes is uncontrolled, yes, definitely they are more likely to get severe COVID symptoms. And also remember that type 2 diabetic patients are usually much older. They may also have hypertension, heart disease, other comorbidities, and therefore, taken as a whole, people with type 2 diabetes generally can get more severe forms of COVID-19. And that is actually explained here. For doctors who have been following COVID-19, this is nothing new, but just to so that everybody is on the same page. Now, when the SARS-CoV-2, the novel virus, enters into the respiratory tract, what happens is that it stimulates, like any infection, it will stimulate an immune reaction from the body. And as long as our body's immune systems, whether it is cellular immunity with macrophage activity and so on, or whether it is humoral immunity, that is from the blood through the formation of antibodies and so on, as shown here, they finally, like, if your immune system is very strong and your diabetes well controlled, you can kill the COVID SARS-CoV-2 virus which enters, and you do not get any symptoms, as many people have told us. They really did not get any symptoms. But if your diabetes is uncontrolled, or if your immunity levels are very low, and that is where Dr. Sandeep did mention about the indiscriminate use of steroids now. Well, steroids are life-saving. People have started giving steroids as prevention of COVID. Nothing can be further from the truth, because when you give steroids, you're lowering the immunity and inviting the SARS-CoV-2 to take over your body and to produce a severe reaction. So that being said, if your diabetes is uncontrolled, then instead of our body defeating the virus now takes over, and then it creates a typical storm inside the body, and that's called as a cytokine storm, where the immune response is totally dysregulated. It's like an uncontrolled fire or a bomb taking off in the body, which leads to multiple problems in the body, including ARDS and acute renal injury, cardiac injury, pulmonary injury. It can also produce, worsen the diabetic state, produce blood pressure, all kinds of problems, which ultimately can lead to death as well in some cases. And that's why it's very important to keep the diabetes under control, so that even though the SARS-CoV-2 enters, we don't allow it to enter into the cytokine storm. And I'd like to again repeat saying that thousands of my patients have had, both type 1 and type 2 diabetic patients have recovered without any sequelae from COVID-19, and therefore one need not be afraid that just because you've got diabetes you're going to do poorly. But the facts are there right from the first figures from Wuhan in China a little more than a year ago, where the overall death rates were reported to be 2%, but in people with diabetes it was 7%, people with CVD it was 10%, and older people 80 years of age it was 15%. So there are a lot of risk factors which make you do poorly. But if you nowadays we know that the death rates are actually much lower than this. It's not 2%. It's probably about 0.5% if it is treated properly. Now, what extra precautions should people with diabetes take? And I'm going to make this a very general talk, because this is what you should be telling all your patients when they come to you, that you should first of all control your diabetes well. Check your blood sugars often to ensure good control. Eat healthy diet. That means you should take more of vegetables, fruit, and protein. Now, this will give you all the zinc and the vitamins and everything that you need. You really don't have to, load yourself with all these, so-called immune boosting drugs, because excess of them can also produce harm. In fact, some of these indiscriminate use of iron and so on may actually induce mucormycosis or worsen mucormycosis. There is evidence for that as well. So eating healthy, and I'll come back to that. Exercising regularly is very important. The role of pranayama. Of course, there are videos going around that your nitric oxide will increase, and I wonder who tested that nitric oxide. All these guys who come and say inside your lung, your nitric oxide. Are we measuring nitric oxide to see? I don't know the mechanism, but the fact remains that by doing pranayama, your lung function improves. More oxygenation is going to occur. And pranayama also has another benefit. It decreases your stress, your tension, your depression will definitely go down. You just try it for 15 minutes. You'll know how good you feel, because this is something which everybody should do. COVID, no COVID, diabetes, no diabetes, doesn't matter. Everybody should do it. I do it 365 days in a year because I'm a strong believer in that. I know the benefits of that also. So these are the general principles. Let's talk about this in a little more detail. I made a video which went viral last year, and that I said as 5 tips for improving immunity, or 5 ways of improving immunity. That video is one of my most popular videos. So I talked about these 5 things: diet, eat healthy and nutritious food, exercise regularly, reduce stress and anxiety, sleep well. Sleep is very, very important. Sleep well, and of course, control chronic conditions like diabetes and hypertension. So let's talk about each of these. When you talk about diet, this is the simple thing that you will have to tell people how to eat. And this is not only for people with diabetes. You and I, all of us can eat like that. That when you start eating, don't put, when you're in South India or in East India, what do we put first? A mountain of rice on our plate. We eat it with sambar or with some other curry or something. And then again, we have another mountain of rice. And the second course comes now with rasam or something else. And then the third course comes with curd or with something else. And so we're eating rice and rice and rice more and more. Or it'll be chapati, 2 chapati, 3 chapati, 4 chapati, 8 chapati. It goes on and on because we are a carb nation. I don't think we should be eating so much of carb because too much of carbohydrate produces insulin resistance. And this produces subclinical inflammation, which is what worsens COVID-19. So how should you eat? Take half the plate and fill it with vegetables of all different colors. I'll show you that. Different colors. And then quarter of the plate, reserve it for protein. If you're a non-vegetarian, you can get it from fish or chicken, white of the egg, and so on. If you're a vegetarian, you need to get it from all these pulses like Bengal gram, green gram, black gram, soya, rajma, and all of that. Little bit of curd always helps because it's a probiotic. And then in the last quarter of the plate, you keep for 1 chapati, maximum 2, or a little bit of rice. That's the amount of rice that you should be eating, only a quarter plate. If you do this, your immunity will improve, your sugar will get under control, you lose weight, and you will generally do well. This is something which you have to teach all patients who come to you. Let's move on to exercise. We all know that exercise has multiple benefits. Reduce the blood sugar level, decrease the cholesterol, the bad cholesterol, increases the good cholesterol, HDL cholesterol, decrease triglyceride, decrease blood pressure, decrease weight, decreases body fat, increases muscle mass, decreases insulin resistance, stress, and prevents complications. So by just doing that half an hour or 1 hour of exercise, you are getting all these benefits. And obviously all of these will help you when you have COVID-19 as well. This is something which I coined. I call it as the FAR principle, F-A-R, FAR. What is FAR? FAR, F stands for flexibility. And that's what these two people are showing here, this gentleman and this lady. You should be able to stretch back, stretch forward, stretch down, touch your legs, touch your toes, so all this is part of your flexibility. This will make your muscle stronger, your bones stronger, your back stronger, your vertebral column stronger, and everything stronger. And also you won't fall if you have good flexibility. Second is aerobic exercise. There you get your walking, your jogging, your cycling, your swimming, or whatever you want, where you move from one place to another, where you burn the oxygen, and that's why it's called aerobic exercise. The last is resistance training, where you can do weights. You can do either small weights for your hands or little bigger weights if you are young. Older people can just do small weights, both for the lower limb as well as the upper limb. You have to do that, strengthen it, because that is where your muscle, Indians have less of muscle mass and they have more of fat, especially intra-abdominal fat. If you do these three, you can be very, very fit, and your immunity level will definitely build up. These are people who do well even if they get COVID. So remember the FAR principle. Now the flexibility and aerobics, the F and A, you should do every day. Okay, the R you can do twice a week or thrice a week. It's not necessary to do weights every single day. Okay, next we'll go to stress and anxiety. Now stress is one of the most important reasons why people do badly. Let me tell you a tip about this. We encourage everybody to use pulse oximeter, and then if it goes down below 94, we say rush to the hospital. I can tell you that just your stress and your anxiety, which produces shallow breathing. Now you're so scared, that you're breathing like that. And when you do that, what happens is your oxygen saturation will shoot down. So it will go below 94 and you'll think you're dying due to COVID and you need oxygen and so on. May not be necessary. Okay. Maybe it's just because you're not breathing properly. And that is why I said pranayama is very important. Relaxing, doing pranayama. You can also relax in any other way. If it's music which relaxes you, do that. If it's playing with your family which is helping you, do that. If you have a pet, you do that. Whatever helps you to recreational, counseling, whatever it is. Okay. Yoga, of course, is the best form of stress reduction, no doubt about it. So following a life of moderation and doing nothing in extremes. Sleep, I told you, is very important. Recently, from the Pure study, I was involved in 2 major publications, and that is what is shown here. One, we worked out the sleeping patterns of 150,000 people in 21 countries and 5 continents and linked that to mortality. How do people die and what do they die of and what were they doing? How many hours of sleep were they getting? What we found is those who get 6 to 8 hours of sleep, they did the best. Those who got less than 6 hours, 4 hours, 5 hours, saying that is enough for me, I am a very tough man. I know I don't need that many hours of sleep, they tended to die, suddenly get a heart attack and die. And similarly, if you had more than 8 hours of sleep, 9 hours, 10 hours, 11 hours, more number of hours you have more than 8, it shows you're a very sick person. Your health is not good. That's why you need so many hours of sleep. So 6 to 8 seem to be the median of 7. From 6 to 8, anything is all right. Second most important, another paper we published, looking at the time when people went into bed. So we timed it from some people went to bed at 6 o'clock in the evening. Some go to sleep at 3 a.m. in the morning or 4 a.m. in the morning. So we traced all of them and looked at the mortality in another publication. What we found was that when people went to bed between 10 to 12 midnight, they did the best. So between 10, 10:30, 11, 11:30. After 12, mortality goes up. Those who sleep at 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, the later you sleep, there is more mortality. Interestingly, when they sleep earlier, 9 is okay. But if they sleep at 8 o'clock, 7 o'clock, 6 o'clock, there's something wrong with you. That's why you have to get into bed at 6 o'clock and 7 o'clock. Okay. If you by 7, if you have to, fall off asleep, there's something wrong. So these are all things which came out from our extensive studies in the PURE study. Now, controlling chronic conditions like diabetes and hypertension is very important. I already talked about diet. I already talked about exercise. Education is very important because unless you teach people why you have to do diet and exercise, they won't follow it. And of course, medicines are also very important. So people have to take their medicines regularly. And now there's a lot of myth, the alternative systems keep hammering the scientific modern medicines, saying that all your medicines are toxic and anybody who takes their diabetic medicines regularly will get kidney disease, heart disease, this disease, that disease. Believe me, I've been in this field for now 50 years. If you judiciously use medicines, whichever medicines that you're using, especially anti-diabetic drugs, they're all safe. I have not seen people use anti-diabetic medicines and develop kidney failure due to that. If they develop kidney failure, it's because their diabetes is not controlled, not because of the medicines. So these medicines must be used properly. They must know how to use it. A specialist can use it, and they are absolutely safe. Now, one thing I wanted to tell you, I'm sure many of you are already using this. This is a small patch, and this patch is applied on the arm, and this continuously reads the blood sugars throughout the day. So it's like a 2 rupee coin, and you put it on. For those of you I'm explaining, for those who have not seen it or heard about it, if you put it on your hand, it gives you up to 100 blood sugars in a day, and then it will give you graph after graph after graph, which comes out like this. So you can see that there's a patient who came to me, and there's something called as time in target or time in range, TIR we call it, time in range. Now, this person is supposed to have blood sugar between 70 and 180, this gray shaded area. But you can see that the first day when he came, somewhere 8 o'clock in the night, we started the sensor, and you can see that 100% of the time is above range. That means the sugars are above range 100% of the time. Then we started the treatment, and the first day nothing happened. Again, 100% is above the range. Third day also nothing happened. 100% is above range. Fourth day, it's still 100% above range, but you can see the sugars have started dropping a little bit, whereas here it didn't drop at all. Fifth day, it started coming down. You can see the sugars are touching normal. Now 19% from 0% in target, it has become 19% in target, and now 81% only is above target. Next day, 65% is in target and only 35% is below target. And by day 9, almost 100% is under target. So you can see how a person who had no control at all now has almost 100% control. This is the art of precision diabetes treatment. This is what specialists like us do, and that's why we are able to get the sugars continuously under control. It's very important for somebody in this COVID era to keep the sugars absolutely under control, as shown here. I'll get you a laser pointer. And as you can see here, throughout under control, these are kind of people who do very well, even if they get COVID-19. Now, this particular patient, I put one more patch just to see whether in the next 2 weeks it is going low, because there's also something called time below range. This is time above range, and that is time in range. Now you can see the time in range, which the previous time was 0%, as you can see here, has now become 98%, 95%, 99%, 100%, 100%, 100%, 100%, 100%, 100%, and after 2 weeks, 98% is in target, time in target, or TIR. 2% is below target, and 0% is above target. Where he had 100% above target, now it is 0%. So the sugar is 100% controlled. His HbA1c will come down to 5.6 or something, and he's going to get very good control. No hypos at all, hardly 2%, which is hardly anything. You can see, maybe I put the limit at 70, maybe it went to 69 or something, which is not much. Okay, so this is how we assess diabetes control. Fasting blood sugar between 100 to 120, postprandial between 120 to 160, A1C less than 7%, and time in range, which I just talked about now, should be at least 70%, if possible even 100%. Now, a few more questions. Can COVID-19 precipitate new onset diabetes? That means somebody who didn't have diabetes, because of COVID, can you get diabetes? Yes, it can, by several mechanisms. Number one, stress that can produce. Always you're afraid. Finally, all your counter-regulatory hormones go up, insulin cannot work, and you get diabetes. That is one mechanism. Second mechanism is irregular lifestyle. Now, lockdown has started. Instead of increasing your exercise wherever possible, if you have a room like this and keep on walking inside your room and getting your steps. So if you give up now and say, oh, because of lockdown, I can't do anything, then your activity will go down and you'll tend to put on weight. Second is unhealthy diet, because during this time you must be eating more healthy diet, so you must take fruits, vegetables, but you say, I can't get that now because of lockdown, and so on. And so unhealthy diet also, decreased physical activity also, you'll put on weight. Obesity is one of the common causes of diabetes. So COVID didn't produce it, but the obesity produced it. Third is direct viral damage to the pancreatic beta cells. Now, till recently, we didn't have evidence. I'm going to show you for the first time some new data here, which many people may not be aware of it. I was very excited when I saw this. This is a paper which is published in Nature Metabolism just a few weeks ago, in 2021 only, you can see. This is a Nature group, Nature Metabolism. So where the authors show, and the title of the paper is SARS-CoV-2 infects and replicates in cells of the human endocrine exocrine pancreas. So they took out, first they did two kinds of things. One, they took postmortem of people who died with COVID, took out the pancreas and saw whether they could see SARS-CoV-2 virus inside the pancreas, and they were able to see that, and whether any destruction took place. Secondly, what they did was they took cultured human islet cells and then injected the SARS-CoV-2 into that and saw what happened to the beta cell. That was experimental. They saw inside cultured cells, they injected this and they saw what happened. Then they injected remdesivir to see whether it prevents it. Very fascinating the results are. You can see this is the uninfected beta cells, and these are the islet cells. You can see that there are a lot of islet cells here, and there are no SARS-CoV-2. Now here what's happened is that this is in a person who died. This is in the cultured cell. You can see that there are SARS-CoV-2 inside the beta cell, and it's destroying all the islet cells. So you're not seeing the islet cells at all now. You're seeing the SARS-CoV-2, but all the beta cells are damaged. Okay, and if you go to this one, you can see that once remdesivir has been given, some of the islet cells are now retained. So there is some evidence that this remdesivir can protect the beta cells, and this is one of the first experimental evidence. They also took this pancreas of people who died, and they were able to demonstrate inside the pancreas beta cell damage which occurred. Okay, now let me move on to mucormycosis. So this is also briefly mentioned because this is becoming another epidemic now. So what is mucormycosis? A very rare infection caused by a mucor mold, which is commonly found in soil, plants, manure, decaying fruits and vegetables. And even in the nose of healthy people, occasionally you can pick up little mucormycosis. It affects the sinuses and brain and lungs and can be life-threatening in diabetic people or severely immunocompromised people. Example, those with cancer, HIV, AIDS, and so on. Once it starts spreading, up to 50% mortality is there. It is triggered by the use of steroids. Steroid is given as a life-saving treatment, but sometimes very huge doses are given. And while the steroids can reduce inflammation in the lungs and stop it, but they also reduce the immunity and also push up the blood sugar levels, which is a perfect setting for mucormycosis to come. Okay, and this is the kind of infection, severe infection. You can see the nose, completely damaged with this mucormycosis, and here it's now spreading to the eye. You can see the eye getting inflamed, and once this eye is actually protruding. Proptosis has already started. Ptosis is there because extraocular muscles get affected. Lid edema, proptosis, ophthalmoplegia, central retinal occlusion, vein occlusion can come, and sometimes an endophthalmitis can come, and you can lose vision, and sometimes the whole eye has to be taken out, and sometimes even the jaw has to be completely operated, and so on. It can also lead to ketoacidosis, and the treatment, of course, is surgical drainage and treatment thing, and amphotericin B, which the newer varieties, liposomal forms have come, which are safer. The older varieties were very toxic, nephrotoxic, but now better varieties have come. But all these are, it's better to prevent mucormycosis than try to treat it. So I would say that to me, mucormycosis, one more reason why diabetes control has to be very good when treating patients with COVID-19. This is a kind of recommendation. This is mostly based on an article published in the Lancet. That what kind of recommendations do you give for people for diabetes and COVID? In the outpatient diabetes care, sensitization of the patient regarding better diabetes control, optimization of current therapies, not to continue this treatment. People think when they get COVID, they short diabetic treatment. They should not. It will get worse. So you should actually be stricter with the treatment medication. Of course, diet, exercise, stress reduction, already told you. Use of telemedicine. You're not able to go to the hospital, you can still talk to patients. I've done so many teleconsultations today to people all over the country, from Mumbai, Delhi, all kinds of places. People have been talking to me about their diabetes even today, even from abroad. And inpatient diabetes care, plasma glucose monitoring, maintaining ketone levels normal, pH, insulin adjustment, all these are very important. Can people with diabetes undergo vaccination against COVID-19? Of course, yes. In fact, if anything, they should be given priority for vaccination. So these are people who do badly. So you'll have to actually give priority and then do the vaccination. So in conclusion, ladies and gentlemen, before we take some questions, I'd like to say that COVID-19 diabetes have a bi-directional relationship. In other words, COVID-19 produce diabetes, diabetes can produce COVID-19 and worsen it. COVID has taught us the importance of NCDs like diabetes, as they increase the risk of morbidity and mortality. And it's, as already mentioned several times, that people with diabetes, hypertension, heart disease, they do worse. And therefore, don't neglect NCDs at the time of COVID. In fact, when the government tells us, change all your hospitals into COVID hospital, I said, if you don't treat NCDs, people are going to die, both due to COVID and due to non-COVID also. So NCDs should not be, they should be given as much importance as COVID. Obviously, it's very important to focus on COVID at this time, but NCDs should not be forgotten. Okay, I just want to tell you that in social media, if some of you want to listen to more detailed about some of these things, we are there in social media, both my personal one as well as the hospital. Mine, if you just write Dr. V. Mohan or Dr. Mohan V on all the social platforms like Facebook, Twitter, YouTube, Instagram, LinkedIn, there are so many videos and things we already stored, and the same thing is there in the hospital as well. And this is my autobiography. It was already mentioned, so I'm very happy that a lot of you have read it and given very good feedback. And these are some of my videos in case you all are interested to learn more about any of these. A lot of them talked about mucormycosis, talked about vaccination, talked about A1C, its importance, metformin, and many other things. So I'm going to now stop sharing here, and I'm sure a lot of questions would have come up in the chat box, and so I leave it to Dr. Sandeep Balla to ask the questions.
Thank you, sir, for elaborating this topic, because this is a need of an hour where a lot of queries are coming regarding how the diabetes patient, because the movement to the hospitals have stopped now. Consultations, face-to-face consultations, during the COVID-19 era has stopped. So teleconsultation is the mode now where people are. I think people should be in touch with their primary care physicians, with their doctors for the better management of a diabetes control. Because if you don't control it, it is going to create a big havoc. And the message is very, very clear. Don't take it lightly, because the creation of this mucormycosis and over usage of steroids, which are creating a big havoc for all of us. I think it's a total mismanagement which we all do. So I think you have touched, sir, very appropriate subject, and the topics like you have touched about the putative mechanism contributing to the increased severity of COVID-19 patients with diabetes mellitus. You have also touched that the case fatality rate is high among about COVID-19 patient with diabetes. What extra precautions should people take with diabetes? 5 tips. That is the wonderful slide which you are having. 5 tips for improving the immunity. That is, first is diet, second is exercise, third is reduce stress and anxiety, sleep well. And in the sleep well also, the timeline which you have, time duration which you have mentioned, 6 to 8 hours. Some people think 4 hours, as you have mentioned very clearly, that they feel they were very strong, and some people over also after 8 or 10, 11, 12 hours creates a lethargy. Then you touched about management of diabetes and hypertension. You in the diet, you talked about too much of carbohydrate induces insulin resistance, and ultimately it is going to cause the inflammation and more prone for the COVID-19 cases. Your FOR principle, that is flexibility, aerobic exercise, resistance training, that is very clear-cut message. One must live a life of moderation and do nothing in extremes. So we should live in a moderate way, nothing, we should not do anything in extremes. You also touched very well, sir. Can COVID-19 precipitate new onset of diabetes or not? And then finally, sir, mucormycosis, RHINO mucormycosis, and the recommendations for the diabetes and COVID-19 for patient outpatients also, as well as for patient having the diabetes inpatients also. And in conclusion, you have touched that COVID and diabetes have a bi-directional relationship. I think this is a very straight away message that all of us should know. And COVID-19 also taught us the importance of NCDs. And though NCDs are already taking a big burden in the global arena, around 60% of the morbidity and mortality is due to NCDs, but COVID-19 has touched this NCD issue in a very, very, very big way. There are a lot of questions and queries which has put it up, which has come up in question. I will go, sir, one by one. Yep. There is a query from a doctor. I am aged 47. I'm diabetic, recently detected with motor neuron disorder. I am on insulin dosage as prescribed by my doctor. Do you suggest any special care I need to take to keep myself safe?
I think there are two separate conditions. I think unfortunate that motor neuron disease and diabetes are coexisting in you. But I think keeping the diabetes under control will definitely help the motor neuron disease in some way, because any inflammation, anything that you now further add on to the insult, to the injury, that disease can also get worse. So we say that in the presence of diabetes, any disease can get worse. So while on one side, the treatment for that goes on the other side, keeping your diabetes under good control is all that is needed. I don't see anything other than that special to be done.
Another thing is that gestational diabetes patient, can they take COVID vaccine or not?
Right now, during pregnancy, it is not recommended. And so lactation and pregnancy are considered, because the trials have not been done. I think there are some trials going on, if I'm not mistaken. But right now, I would suggest that unless your obstetrician clears it, and unless there is evidence to take it, because we don't know the effect on the child and the fetus and so on. So when these trials were done in a hurry, the vaccine, because of obvious reason, because before people die, they have to bring it out. And so I think children only now the trials have started. And I think pregnant women, there may be trials going on. So let that also be completed. Once they say, yes, it is safe, you can take. Otherwise, just stay safe and avoid the COVID. That will be good. I know many people who have during pregnancy got COVID, but they came out okay. The baby was okay and everything was fine. So it is not that the baby is going to get very badly affected or something, but follow the precautions and be safe. But I won't recommend it until the guidelines become very clear that you can take it during pregnancy.
Thank you, sir. Should we start insulin for diabetes patients on people taking oral steroids due to high inflammatory markers?
Almost definitely you will need it, because steroids are something which suddenly the sugar will go up. Within one day it can go up. The moment you start the steroid, by afternoon you'll find the sugar going high. How are you going to match your tablet to that? You can't say I'll give a sulfonylurea to match that or metformin to match it. It doesn't occur. Whereas the short-acting insulin you can easily give. So I think if there, of course, there are a small group of patients whom the sugar, nothing happens. Steroid is given, sugar doesn't touch them. Then it's okay. Then you don't, I'm not saying if your sugar is normal, you should go and take insulin. But otherwise, if the sugars are going up, giving the insulin to match that would be the best way to do that. The way I say it is, suppose you're not on steroids and you've got COVID-19, which is very mild. Your HbA1c is under good control. You're on tablets and your COVID is also very mild. Don't change anything. Just for that, don't rush and now give insulin and all that. Watch the sugars, do more testing. It's under control. It's a very mild infection. The body is able to tolerate it. Continue with the tablet itself. But if the sugars start shooting up, or if the COVID becomes very severe and you have to go into hospital, better to give insulin, because insulin does have anti-inflammatory property, which the tablets don't have. Tablets will only just lower the glucose. Insulin lower the glucose, plus it has anti-inflammatory activity. Therefore, from that point of view, it's also an anabolic hormone. It helps with the repair of tissues. And therefore, I think insulin's benefits go beyond tablets, beyond glucose lowering. So therefore, whenever needed, you can give it, but it doesn't mean every case of COVID-19 you have to give insulin.
Thank you, sir. How to calculate the dose of insulin in known diabetics with COVID who are having steroids?
It's, I mean, there's no formula for that. You see how high the sugar is going. Let's say before this steroid was given, the blood sugar was say 200, okay, or 180. Now it has gone to 280. You know, about 100 milligrams higher it has gone. So you start with a small dose. First day you can give say 4 units or 6 units of insulin. See whether it is covering. Suppose it's only for 3-4 hours it's going up and then it's coming down again. It's clearly just the steroid effect. So you just give that one shot of insulin, probably it will come down. But suppose throughout the day the sugars have gone high, then you will probably need 2 or 3 injections of insulin to cover that particular period. And that is where I think this ambulatory glucose profile and the sensor comes in. It become very useful. CGM become very useful. But then you can monitor the sugars as you give the insulin. Within 2 hours, you'll know whether it's coming down or not. So based on that CGM, it's so easy to adjust. So whenever my patient is on a steroid for this particular condition, I straight away put them on the CGM. And then the patient himself or herself can monitor and say, I'll tell them, all right, there's so much increase by 2 units. Next day, you see that, send the graph back to me. And they'll say, now it has come down, doctor. See, you can do. So you can teach the patient itself to adjust the dose based on that. It's a kind of beauty, it's a kind of marvel when you have continuous glucose monitoring. It makes it so much easier.
A lot of people have appreciated the talk, and one of them is our own Dr. V.K. Vichandani from.
Hello, Dr. Vichandani.
Thank you, sir, for.
Thank you for your kind words. Yeah.
Can patients use the continuous glucose monitoring system at home?
Of course, they can use it. It's meant to be used at home. So there are 2 types, as you know, we have, of course, there are other companies also making it. Medtronic has the iPro Pro 2 system. Then Dexcom is not very freely available now. But the Abbott ones, there are 2. One is the FreeStyle Libre Pro, where you put the thing and then they send the graph to you and then you do it retrospectively. You can do it after 3 days, 4 days, 5 days, and so on. Or you can lend a reader to them to have it. But now the FreeStyle Libre has come. Once the Libre has come, patient buys a reader also along with that. And once they put the scanner, they have a reader. All they have to do is to just scan like that, just over the arm like that. And immediately they get the reading on their either phone or on the thing or computer or wherever. And they can, or on the reader, and which they can download also. So that will give continuous glucose monitoring throughout the day. So it's become very simple now to monitor one's sugars.
What's the effect of COVID-19 on pancreas that do not produce insulin in patient of type 1 diabetes, which is totally dependent on insulin from outside?
So COVID-19 works in different ways. We do not know. First of all, we know as an infection, the sugars will go up. Second, due to the treatment that is given, there are even some of these antiviral drugs and remdesivir, and all of them are supposed to have some effect on the glucose level. Third is steroid. When you give the steroid, of course, sugar is going for a 6. So in multiple ways, you will find that the COVID is related to very high blood sugar levels. Now, the question which some people ask is, you showed those beta cells getting damaged. So does it really produce type 1 diabetes itself? I saw a question there also, Dr. Varalakshmi had asked, that does it really produce type 1 diabetes? We're looking for it, Dr. Varalakshmi. So we have formed an international COVID registry, new onset COVID registry, not COVID we call it. And everyone is pooling the data into that. And wherever C-peptide data is available, we are putting that. Where GAD antibody is available, we are putting that. And so after seeing all that, we are trying to sort out what exactly is the problem, and is the pancreas really getting damaged and producing type 1 diabetes. Stray cases have been reported, 1 or 2. We don't know whether it's already a type 1 who is going to get it, who because of this infection. We know that viral infection can produce type 1 diabetes, Coxsackie B, and many others have been known to produce. So like that, is it one of this which is going to trigger? Or did the type 1 just come and because the infection, it got picked up? That also we don't know. Till now, we don't have a definite answer that this is a COVID-induced diabetes, and only because of that, it's a direct viral insult. We are suspecting it, but we are not yet proved it. But Dr. Anup Mishra and I published a paper. What we did was we looked at all the new onset diabetes cases during the COVID year, and that is 2020. And then we also looked at in 2019 when there was no COVID, all the new onset diabetes patients that he saw in Delhi and what we saw in our centers, mostly in Chennai. We pooled the data and we published it. What we found was that the overall fasting blood sugar was higher in 2020, postprandial blood sugar was higher in 2020, the HbA1c was higher in all the new onset cases. So the same year, whole year we have taken. So all the 2020 patients had higher fasting PP, HbA1c. Some of them had COVID, some of them didn't have COVID. We tried to see whether the COVID patients had higher. We are not able to show like that, even the non-COVID patients. But remember, we had lockdown. So because of the non-COVID, the patients also would not have come to hospital at all. So that was explained like that. We measured C-peptide in a lot of people and saw whether 2019 C-peptide is better than 2020 C-peptide. We couldn't find that also. So we're not able to find it. And then we compared those who had COVID antibody positivity with those who did not have COVID antibody positivity. Was there any difference? Again, we could not find anything. So if at all this COVID-induced diabetes, that's a very small number. Otherwise, by now we'd have seen lots of cases. But as the epidemic goes on, we don't know. Maybe there could be a few cases like that. We'll have to keep our eyes open.
Thank you. How many times the blood sugar should be measured in known diabetics who are in home isolation?
It depends on the kind of control that you have. If you're under very good control and if your HbA1c is good, when you're testing your sugars, you're finding fasting is 90, postprandial is 130, 100. You don't really keep on poking yourself because you may introduce some infection by doing that. So you don't have to do that. But suppose your sugars are fluctuating, or you are on insulin, or you have a type 1 diabetes, then you must increase your testing because you normally test 2 or 3 times a day. Now make it 4 or 5 times a day because you would like to keep all the sugars under control. And it is such people who benefit from the AGP sensor, because if you're poking yourself 5 times a day, 6 times a day, why don't you just put the patch? Then it will tell you throughout the day how your sugars are.
Any additional care for type 1 diabetes which we have to take during this COVID arena?
Take care, additional testing, follow your diet, don't miss your insulin. If necessary, if your sugars are going up, adjust the dose of the insulin, increase the testing frequency, drink plenty of water, don't get dehydrated because dehydration can again precipitate DKA. Try not to expose yourself to unnecessary infection, wear a mask, protect yourself. These are things which I think we have to do. Incidentally, many of my, both children as well as adults with type 1 have got COVID and they have recovered. Very few have really done poorly because they've all been looking after themselves. And I've not had a touch wood till now. I think that my type 1 have also done very, very well. My type 2s have also done very well. Of course, 1 or 2 did not do well, but that is inevitable. They have other comorbidities and so on. But it's not that every diabetic patient did badly. I want to tell you one more thing. There was a prediction that during the first lockdown that we had last year, that everybody's HbA1c is going to go very, very, very high. So we did a large study and we published it in Diabetes Technology and Therapeutics, where we looked at about 3,000 patients of ours across the country. And we looked at the HbA1c during the lockdown period. We were expecting HbA1c will increase by 2, 3, 4. We actually found a drop in HbA1c by 0.5% in these people. And the reason for that was that so much of fear was there. This time around, there's no fear. People have got the fear fatigue itself has come. But at that time, they were all scared, and everywhere they were reading about diabetes being a comorbidity. So they looked after their diet. They started taking their medicines. Some of them started exercising wherever they could, and they were able to find that the sugars were kept under good control, and they did not, actually the HbA1c is improved. And when we first showed that, everyone was surprised. How can it improve? Subsequently from Bombay, there's another report, and other countries have also shown that people have, one set of people looked after themselves very well. The other set of people gave up. They said, oh, there is no this thing, that is not possible, this is not possible. And then their A1Cs went haywire. So it all depends on us whether we want to look after or not.
Thank you, sir. Is it okay for kids taking the Zincovit vitamin D for type 1 diabetes? Because today in scenario, a lot of people have entered into taking multivitamins and immunobooster drugs and all that.
I don't think there's anything wrong in it, but I think people are overdoing it. And, we also know that zinc and all that taken in excess can produce toxicity. We know that iron, if it is taken too much, this mucormycosis can be, the free iron, if it increases, mucormycosis actually increases. So some of these things have side effect. Vitamin C, too much you take, produce acidity, and that is also not very good. You can get most of it from your food. Vitamin D is a little different, because vitamin D, Indians are very deficient in vitamin D. 70 to 80% of Indians have vitamin D deficiency. So if you test your vitamin D and you find it is low, please take vitamin D, because vitamin D protects. Vitamin D, if you normalize your vitamin D levels, your COVID, response is much better. Your prognosis improves. So vitamin D, I wouldn't hesitate to give. Even if your vitamin D is normal, if you go and take little vitamin D, if you're not able to do the vitamin D test, the toxicity is not that common if you take the usual oral doses of vitamin D. Only if you take an injection, you will get toxicity. But all the other things, this zinc and things, they're not really proven. Because at the cellular level, it has to work. So just by swallowing one zinc capsule, whether you will be protected from COVID or things like that, it's a bit far-fetched. But if your doctor asks you to take it, I don't see any reason for a short term, few months or something if you take it.
Since there is a beta cell destruction with COVID infection, will it result in type 1 diabetes? And what is the
Dr. Varalakshmi's question? Well, theoretically, yes. Theoretically, it can. But the ones who have been present that whole year, I told you, 2020, we looked at all the type 1s who came to us. They did not have COVID infection, So I was seeing whether, suppose in 2019, let's say I saw 100 type 1s, and in 2020, I saw 200 type 1s. Then there's a clear thing that it has produced, COVID has produced. The number of type 1s were the same in 2020, 2019, and 2020. So type 1 keeps on occurring at one stage. But the COVID-induced type 1, I'm still trying to, really fix that and to say that yes or no. This experimental study which I showed, Nature Metabolism, is one of the first to show inside the beta cells the SARS-CoV-2 and so on. Very early evidence, and subsequently an editorial was written where they said that it's too early to conclude. Let's keep that as an observation, as a hypothesis. For right now, we are not able to conclude.
Thank you, sir. In treating moderate COVID with steroids in non-diabetic patients, how to handle high blood sugar in these situations?
You have to treat it with insulin. There's no other go. So the moment you're starting steroid, on the same day, you can expect the sugar to go up. I would say that if the ideal situation is there, the day you're starting, you're going to start steroid, put the patch. Put the patch or multiple daily dose, mainly multiple injection. That's pricking to see the glucose test. Only these two, one of these two has to be done. Either of them has to be done. No question. Because you're going to shoot up the sugar levels voluntarily. You're knowing that and you're going to do it. You cannot just leave it like that without testing the sugar. So lab tests also can be done, but I think you should do either SMBG increase or still better put a patch. Okay. Once you do that, it becomes very easy. Now you start adjusting the insulin dose, watch that graph and see that that graph is come down and the time in range is maintained. If you're able to do that, then the steroid is not going to do that harm, is not going to do, then probably the risk of mucormycosis, all this will also come down.
Post-COVID-19 infection, hyperglycemia, not known diabetes earlier. Should anti-diabetes drugs be started and how long?
If the sugars are very high for a small period, we do give. So I've seen patients who did not have diabetes. Then in the ICU setting, they pushed in huge doses of steroids, developed very high sugars. They came to me, and because they did not have diabetes earlier, I said this may go away as the steroids are coming down. Continue the insulin. So slowly the insulin, as the steroid dose is brought down, we tapered down the insulin dose. And after some time, the steroid was stopped, the diabetes also went away and the insulin was stopped. So that's the best scenario. But sometimes what happens, because you're giving the steroids high doses, you may push you into permanent diabetes. And so later on, even when the steroids are withdrawn, the diabetes may continue. You may not need insulin, but you may need tablets, something you may need. So both we are seeing, some which are reversible, some which continue also.
When to start steroids, sir, in COVID patients with diabetes, and preferred type of steroids and dose and duration of the steroid treatment?
Yeah, whether it's with diabetes or without diabetes, the time to start steroid is usually the second week of the COVID. When the first week you have viremia, that time the virus load is very high and the virus is spreading. That time we give steroid, you'll push the virus load even higher. After the first week, the virus is now going away. If you do the RT-PCR, you may not even find the virus. That is a time in some people when the cytokine storm starts. That time you start the steroid. Now, what is the dose of the steroid? There are different regimens being used. So give the appropriate dose based on the clinical condition of the patient, the age of the patient, based on blood sugar levels. All that there are different protocols being followed. You follow whatever is dexamethasone is usually used. Oral is usually not given. Normally IV is given. So you follow whatever protocol is being followed. And then as quickly as possible, as they get improved and as they leave the ICU, start reducing the dose of the steroid, because then the side effects of steroids will start picking up. Once the acute condition is over, oxygen saturation is good, you're out of the ICU now, then you don't need to continue that high steroid dose for a long time, which people do actually. Very quickly start reducing the dose of steroid. Don't drop it, don't stop it immediately, but start dropping the dose, reducing it, and then slowly you can stop it.
Thank you, sir. How many diabetes, how long diabetes may remain in post-COVID diabetes patients?
Now, if it is induced by steroids, it's normally a few weeks. So I've seen it for about a month or two, and then slowly comes back to normal. As I said, in some people, it becomes permanent. It may not go away.
Can you explain that in your presentation, sir, you have mentioned about bidirectional journey of COVID and diabetes. So is it possible that due to COVID in atmosphere and without infection by COVID, HbA1c can raise from 6 to 10? Can you enlighten on that?
As I said, it's not just the COVID alone. It is the COVID and along it's, see, when you give COVID, it's not COVID and you don't get any treatment. No? When you take COVID, you'll be giving medicines, you'll be giving remdesivir, you'll be giving so many things, you may give steroid. The stress of the moment you get COVID, imagine what happens. You start panicking, isn't it? That panic can push up the sugar levels, BP level. I've seen people's BP shoot up to 200. People who didn't have blood pressure, after they get COVID, 190, 200 systolic, it's going. I've seen people develop strokes and all that due to that. So it is that panic situation when the sugar levels and the BP levels shoot up. Whether it's directly the virus which increases the sugar, or the treatment, or the panic, or all of them put together, or the steroids used, is probably. But we know that infections can also increase the sugar. When you have severe infection, we know the vicious cycle, the typical one. Sugar increase infection, infection increase sugar, sugar increase infection, infection increase sugar. So it'll go like that. That's true for even bacterial infections, for urinary infection, for everything is like that. So on one side you give the antibiotic and treat the infection. On the other side you bring down the blood sugar level. That's how we treat all infections. So COVID is not an exception. Here also same thing can happen because the infection is going up. So on one side you control the sugar, on one side you treat the COVID. So both together it will settle down.
Thank you, sir. During my COVID, when I started taking zinc tablet and vitamin C, I started skin allergy in type 2 diabetes. I am type 2 diabetes, but hypertensive and hypothyroidism since 20 years on OAD and insulin. What is your say on this?
Sometimes zinc can produce these kind of changes. Sometimes zinc is used in the treatment of skin conditions, but at the same time, some can react to that. So side effects of zinc are quite a few. And so that's why I said, just treating, if you already got COVID, what's the point in continuing zinc and vitamin C? It's too late. These are more for prevention in the general public, not when you're treating acute COVID, that time giving zinc and giving vitamin C and giving, it's too late. I mean, you shouldn't be giving all that. Stop all that and focus on the drugs which need to be given at that time.
Should we stop metformin and start other oral hypoglycemic agent or insulin in view of respiratory distress caused by infection in home quarantine stable patient?
On the other hand, there have been a lot of papers which have shown that metformin actually helps. Dr. A.K. Singh, Avdesh Kumar Singh from Calcutta has written a beautiful review article on this, showing that metformin is actually beneficial for two drugs have been found to be beneficial. One is the DPP-4 inhibitors, and the other is metformin. Both have been found to be beneficial for patients with COVID-19. Now, it may be that the milder people are treated with these drugs, and therefore they did better, but mortality rates were actually lower in patients on metformin. So just because you have COVID, you don't have to stop metformin. It may be actually doing good. We know that metformin does good even in people with tuberculosis, isn't it? So like that, this may be doing good. But if you are admitted to hospital, the sugars have gone high. Now you're on insulin. So then the question of metformin and all that doesn't arise, because then metformin risk of lactic acidosis always comes up when you're in the ICU setting. So at that kind of situation, I would stop metformin and give only insulin.
Thank you, sir. There are a lot of questions which are based upon the COVID vaccination and diabetes, and whether people should go for a vaccination, those who are diabetic, and some people having age group of more than 80, diabetic, suffering from Parkinson also, whether they go for COVID vaccination or not. So what is your say, sir, on this?
Diabetic patients, no doubt at all, because diabetes is the indication for vaccination. We have given thousands of people vaccination. Until April 30th, we were able to freely give. Then after April 30th, we don't have vaccine now to give. Government is not giving us, and we are not getting direct supply. So we had to suspend it from May 1st. But from March to April, every day we're giving hundreds of patients vaccination. And after giving the vaccination, some of them actually developed COVID a little later, and they had virtually nothing. And even our frontline workers in our hospital, our staff who had taken COVID vaccination earlier, when the families developed COVID, it was very nice to see that the people who are not vaccinated, their CT showed findings and the D-dimer was high, and whereas those who had taken the vaccination, nothing, absolutely clear CT, and then all the blood parameters normal. So like magic, the vaccination seemed to work in many people. But the problem is we cannot generalize for everybody. I used to say a few weeks earlier that if you've taken both your vaccination, you will never get a serious problem with COVID. The moment you say never in COVID, an exception occurs. And therefore, this is a treacherous disease, which every time you make a prediction, you're proved wrong. But the best we can do, what else can we do? One is to take the vaccine, second is to wear a mask and to be safe. These are only two things we can do right now. What else is there for us to do? And then eat healthy, do exercise, reduce stress, do pranayama, be positive, make your mind strong, make your brain strong and your mind strong. And your body strong. That's all we can do right now. The rest is not in our hands.
Thank you, sir. How long the post-COVID diabetes may remain in not otherwise not known diabetes?
You already asked that. So
Yeah.
I said it depends, and sometimes it goes away in 3-4 weeks. Sometimes it lasts much longer.
There are a lot of queries regarding which insulin is better in COVID and role of long-acting insulins.
Usually the short-acting insulin, which is given in an acute situation, in an ICU kind of a situation when you're treating, it's always a short-acting insulins which are giving. Of course, you may use a little long-acting to control the fasting sugar, but usually it's a short-acting insulin. Just one long-acting insulin may not be sufficient, especially if steroids are being used. How can a long-acting insulin cover that? That may not be sufficient.
True, sir. As we all aware that we have high prevalence of diabetes in India, can we consider diabetes at par with other co-infections in increasing mortality among COVID positive patients? And how can we rate diabetes, the risk in relation with immunosuppressive?
It's right on top, because I think the statistics that we saw in the first round, second round, I've not seen any statistics come in, but in the first wave, many governments had published their results, and some of them have been published in international journals also. What are the comorbidities? So diabetes comes right on top. Diabetes and hypertension come right on top. One thing I was a little surprised is obesity playing such a big role. And that, I think, thinking about it, I said, yeah, it's correct. Because see, once you have such gross obesity, your lung expansion is not good. You have sleep apnea, your breathing is not good, your oxygenation is not good, your hypoxia is already there because you're having obesity. So on top of that, when you get COVID and your oxygenation goes down, you desaturate much faster. So obesity, the role of obesity has come out very strong and loud and clear during the COVID. So I think reducing weight and maintaining ideal body weight is very important. But diabetes is right on top there, and on the top of all the NCDs.
What relationship does long-term type 2 diabetes have on GI system? And secondly, does weather has any impact on the sugar fluctuations?
Both are yes. I'll take the sugar fluctuation first. As your long-term diabetes occurs, your beta cell function is going down. And because your beta cells are drying up, the C-peptide is going down. So if you have less C-peptide, your fluctuations start getting more. And so, see, these kind of fluctuations in sugars, which you see in the AGP, you normally see in type 1 diabetes. In type 2 diabetes, the fluctuations are much less, there's much smoother it is. And even if the sugars are very high, you can bring it down smoothly. Whereas in type 1 diabetes, we're going up and down. A long-term diabetic after 15, 20, 30 years will start behaving like a type 1. That is why they need, multiple dose of insulin, and they also start behaving. Their C-peptide starts going down. It may not become zero, but it'll start going down. What is the first one? Long-term GI. So long-term diabetes can affect the autonomic nervous system. And normally we talk about the heart and other places where autonomic nervous system, vagal denervation, resting tachycardia, the drop in blood pressure, postural hypotension. We talk about all that. But you can also get in the GI tract. For example, in the stomach, if your stomach is affected, gastroparesis, the stomach becomes very big, dilated. So that is one. Second, in the intestine, the large intestines, you can get constipation and diarrhea. So diabetic diarrhea is a typical nocturnal, painless, chronic diarrhea, which responds to antibiotics like tetracycline and so on. So that's how we describe a diabetic diarrhea. So that also you get due to that. In very extreme cases, you can get anal sphincteric incontinence, bladder involvement, atonic bladder, automatic bladder, autonomous bladder, lack of bladder sensation, all these things. So the entire, not only GI tract, but the other systems inside can also get affected due to the gallbladder can become enlarged, acalculous cholecystitis, and many other changes in the swallowing problems can be there. Constipation is another common thing which occurs in diabetes.
Recovery chances from COVID is more in type 1 diabetes because they can easily control sugar by adjusting insulin. Does it true, sir? Whether it is true or not, sir?
It's true. It is true to a large extent. Also, the age is one of the advantage. See, most people with type 1 diabetes are 15 years old, 20 years old, 30 years old. They have an age advantage compared to type 2 diabetes who are 40, 50, 60, 70 years old. They're 30 years older. Second, unless they have kidney disease, type 1 diabetic patients do not have hypertension. Here, hypertension then more than 50% of the patients. Number three, unless they have very long duration, the kidney is usually normal. Whereas in type 2 diabetic patient, by the time they have 15, 20 years duration, they're already 60, 70 years. The renal function won't be very good. The cardiac function won't be very good. Blood pressure is there. Metabolic syndrome is there. So with all this, obesity will be there. How many type 1s are obese? Very few. Whereas obesity is very common in type 2 diabetes. For all these reasons, because all the comorbidities are more, people with type 2 diabetes do worse than type 1. So type 1 is better. But there was a study which, and in Germany they showed that, in Italy they showed that, in US they showed that, in India we don't have enough data, but there have been reports saying that type 1s do better. At least my cases have done much better with type 1. But having said that, there was one report which came from UK, which showed that type 2s do badly. I was surprised. And I said, why would type 1s do worse? This logic doesn't fit in. And we had a lot of arguments. We had German professors who came and said, our data is different. Why are these people? Finally, when the paper was published, this is a Guardian, and it came in the newspaper first. So we read that only. When the paper got published, we saw the age of the patients with type 1. They're talking about 72-year-old type 1s. They're not talking about young children. They're not talking about 20 years old. And they're talking about very obese. Many of their type 1s are extremely obese. So they were obese, they were 72 years old, and they had type 1 diabetes. I'm sure by that time they would have had hypertension, they would have had all the other things. So that was one report which showed that type 1s also can do worse than type 2s. But that's a very strange group of type 1s, not like the ones we see.
So last 3 questions more. Apart from steroids, are there any drugs used in COVID treatment which influence blood sugar levels?
There is a theory that remdesivir itself can affect the blood sugar levels. The teclistamab and all the other monoclonal antibodies can affect. Sometimes the antibiotics which are given can affect either lower it or make the sugars higher. So a number of things which are given can affect the blood sugar levels.
Diabetes patients had injuries after healed. Black patches remain at site. What patient will do?
So say that again.
Diabetes patients had injuries after having the black patches remain at site. What patients will do?
Probably they're talking about in the foot and all that.
Yeah, most probably.
Yeah, so probably diabetic dermopathy and other things, micro infarcts. Nothing much. I don't think it's serious unless it's in the toes and the tips of the toes and in the feet itself where you have blackish, then you should rule out gangrene and all that. But otherwise, somewhere else, if it comes, I don't think you need to worry. There's another question from Cynthia Prabhu. She's asking, can you elaborate on new clusters of type 2 diabetes? Yeah, that is something which we discovered. Dr. Anjana was the first author of that. We showed that type 2 diabetes is not one disease, but several diseases. So there are 4 subtypes. The first one is called severe insulin deficient diabetes, or SID, which is lean, thin, young people with severe insulin deficiency. The second one is opposite, IROD, insulin resistant obese diabetic. They're obese, they have metabolic syndrome, and they have insulin resistance. Third is a combined variety. It's called combined insulin resistant deficient variety. That's a unique form which only in Indians we have shown, and they have the lowest HDL and the highest triglycerides, and they do badly also. And the fourth is a mild age-related one, which comes due to age after 50, 60 years of age. So these 4 subtypes you should keep in mind when you treat. Everyone with type 2 diabetes is not the same, because the treatment also depends on which type you are treating.
Well, would complications in long-standing diabetes like CKD affect COVID vaccine efficacy or durability, sir?
We don't know whether they affect the durability of vaccination, because obviously the recovery from COVID won't be that good if you have kidney involvement and all that already you're involved. And if you get COVID, probably the prognosis is worse. But for vaccination, I am not very sure. But you should be careful about the clotting mechanism, because some of these vaccines are known to produce clotting. And it's rare, venous thrombosis and venous clotting. So you should ask your doctor and see whether in such cases, high risk, whether you should give any antiplatelet drugs or anticoagulants for a short period after the vaccination if your risk is very high. It's not yet a guideline, but there are suggestions that in some patients you might have to cover that risk.
What is the best oral anti-diabetic agent drugs in the diabetes patient with mild or moderate kidney disease?
Any of them can be used in mild kidney disease. You can use DPP-4 inhibitors without dose adjustment, linagliptin, with dose adjustment, sitagliptin or vildagliptin you can use. Even in mild SGLT2s are now shown to have kidney benefit. So you can use in mild to moderate. Metformin can be used in mild to moderate. Sulfonylureas must be a little careful because of hypoglycemia, because it can, but if you're adjusting the dose, using it once a day in smaller doses, no harm in using that. So virtually any of these, I wouldn't use pioglitazone because of renal, of the fluid overload chances and cardiac failure chances and so on. But all the other drugs in small doses and mild renal insufficiency is okay. Once the degree of renal insufficiency worsens, insulin is always safer.
Last question, sir. Apart from mucormycosis, what are the other risks of uncontrolled sugars in COVID?
All other infections, getting pneumonia, for example, the ordinary lung infection can go into a secondary pneumonial infection. And that is why even before the COVID vaccination came, we were giving, pneumococcal vaccination as well as influenza vaccination to all our diabetic patients. Last year, we gave thousands of patients. And believe it or not, because of the influenza vaccine being close to the COVID vaccine, because both are corona viruses, the common influenza virus, also a coronavirus. This is also a coronavirus. So many of them who have taken it anecdotally have told me, Doc, because I took that vaccination, I got COVID and I didn't suffer at all. It went away. I don't have a control study to say it. But anyway, influenza vaccine is recommended in people with diabetes. And you can get double infections. I've known in the early stages where people have had COVID plus influenza, at the same time. So that vaccination. Second is pneumococcal. Pneumococcal, if you take it once, throughout life, you're protected. So at this time, if suppose you had taken the pneumococcal vaccine, at least a secondary pneumonia will not come. Even yesterday, I heard somebody who started off at COVID and then he developed pneumonia. And pneumonia became the big problem in older people and all that, and diabetic patients. So taking all these vaccinations are very good. So these are all infections which can come. So then secondly, because you're in hospital, urinary infection and other infections all can come apart from mucormycosis.
From my side, sir, any last message which you want to give to all the audience, because people are having a great queries in their minds, and the people are staying in their great in this pandemic situation. A lot of mindset has totally changed because of the mental agony people are facing. Though you have highlighted very clearly that you have to make yourself make your mind very strong, make your health good. But I still want any last message that you want to give to our all colleagues, sir.
Yeah, thank you, Sandeep. I think the message that I would like to say is we are going through unprecedented times. The first time around last year when I was giving, I was overtly optimistic, and I was giving very, very optimistic because the numbers were not there. People are unnecessarily getting scared. Today, I can't give that much of optimism because there are people dying left and right. Let's face it. Every one of us knows somebody who has passed away. So I can't, belittle it or say, nothing will happen to you and all. That is being very, minimalistic and not being realistic at all. So we have a very dangerous situation on our hands. But what can we do? It's not that we can all, resign ourselves to fate and say, let us wait for us to die. It is not so bad. If you look at the actual numbers of people who have died in India, 3 lakh, 4 lakhs, compared to 1.33 billion. Even if you multiply 2 times, 3 times, saying that we have undercounted the deaths, you cannot undercount it by 100 times. Where are the bodies? First time around, the cemeteries and the burial ground did not even have enough bodies. This time, yes, the cemeteries are getting put. So we know it is 3 times more, 4 times more, whatever. But with all that, the number of people who have totally died due to COVID in India is less than the number of people who died due to diabetes last year in India. Okay. The tuberculosis, 3 times more people have died than COVID. Heart attacks, 5 times, 6 times more than the total number of COVID deaths have occurred. So what about all those deaths in India? 6 times more people are getting heart attacks and dying. 5 times more tuberculosis is killing people. Dengue is killing people. As many as malaria is still killing people. So all these are there. We are not worried about all that. Here we are worried for 2 reasons. One is it's occurring suddenly. It's occurring in a pandemic. And within a week or 10 days, we are hearing of deaths and so on. So therefore, that fear is there. You can only try to prevent it. What else can you do? Every precaution you can do. Wear a mask always. Why are people not wearing a mask? If this is not frighten people, what is going to frighten people? You tell me. This is not frighten people. You will not get frightened. Even if another, 10 million people die, you still not wear a mask. Why are you resisting that? Why don't you go and do that? Then why don't you take the vaccination? Okay, 1 in 5 lakhs may have a reaction. For that, all the 5 lakhs should miss and wait for COVID to come. Okay, so take the vaccination and the mask. These are only 2 things we have. After that, relax. Focus on your work. Forget about COVID and all that. We've got better things to think about. and take all the precautions and continue with your life. If everything goes well, in another few months, this has to become history. The Spanish flu lasted for 2 years. Now we are only 1.5 years now. So another 6 months to 1 year, we're following the same rules, same logic. Now the population is much bigger. Maybe it'll take another 6 months. Many countries have already, UK saying they have only 1 death in the whole country. They have come down to that. We don't know whether the third wave will come there or fourth wave will come there. But whatever it is, how many waves can come after everybody is vaccinated, everybody has got COVID and escape? It's not a viral, keep on coming, So at some point it's going to go. So hang in there, have faith, pray, look after yourself, do whatever needs to be done. Don't give up and don't go and commit suicide and do something and all that. You're not in that stage. If something happens, then it happens. If you go on the way I tell people is the chances of you dying due to COVID today is like your plane crashing. It's of the same risk. You get into a plane, that plane can crash. Okay. So people stop traveling by plane. No, you still go. That risk is always there. Yeah. Everything else, you step onto the road, a lorry suddenly loses thing and comes and hits you, you can die there. So you won't step out on the road, you stay inside your house. If you stay inside your house, your roof may collapse and you may die. If you're working in the field, a coconut can come and hit you, or a jackfruit can hit you and you can die. So what, you won't go to the field, you won't go to thing, you'll go, then you'll touch this and get electricity shock and you'll die. Then you won't touch the computer also, you won't. So I mean, there's a limit, for everything there's a limit. So try to be safe, be strong, give positive messages to people, do what you can. There is above us, there is somebody who decides our fate long ago is already decided. So don't worry about that. There's so much positivity. You can help so many people. Try to help people. Then you will be less worried about yourself. And then take care of your family, take care of your friends, take care of your staff who are working with you, take care of everyone. And let us all pray that very soon we will get over this and COVID will become history. I'm waiting for that day to celebrate.
Great, sir. Thank you, sir, for giving a very lucid talk on this subject. And it's always a pleasure to have you and to learn more on day-to-day basis about the diabetes and the COVID-19 scenario. As India battles this huge crisis, we at ECO India, that is Extension for Community Health Outcome, we deeply value the role of educational these series, which has been supported by SPI Foundation, and appreciate the role of everyone, especially healthcare workforce, to combat this growing burden. On behalf of the leadership of ECO Institute and ECO India, Professor Sanjeev Arora, as well as our chairman of ECO India Trust, Dr. Karnal Kumudra, and Executive Director, Dr. Sunil Anand, and all our colleagues of ECO India family, we are really thankful and humbly thankful to you in a way that you have come out, you have given your productive time to the people, and we pray for the safety and the health of everybody. And the last message which you have said, that try to be safe, be positive, give positive messages, and take care of your family, staff. I think this is the way what we can do. Things will come, things were there. I think if the positive people like us will continue the battle, we will definitely win this. On this behalf, sir, take care, stay safe. Thank you on behalf of ECO India, sir.
Good night. Look forward to more programs with you.
Thank you, sir.
Thank you. Thank you, Dr. Mohan. Thank you so much. Thank you, Dr. Bhalla. Just one thing, I would request everybody to kindly fill in the feedback link that we have. And the upcoming sessions, I'm sure today's session was so enriching that everybody would again want to stay tuned. Just stay tuned. And we have certain other upcoming sessions that we have. We would be starting next Monday onwards, May 17th, with Dr. L.H. Gotekar. The topic is on COVID-19, a holistic approach. Next, we would be having Professor S. Natarajan, a Padma Shri awardee, on topics like how to stay safe, stay protected, stay healthy. Then we would have Dr. Rati Balachandran on the topic role of nursing professionals during the COVID-19 crisis. Then we would be having on May 29th, Dr. Vijay Negalur, who would be talking on COVID-19 diagnosis and management. Lastly, we would be having Dr. Sangeeta Goswami, who would be talking on enhancing emotional well-being and self-compassion. So thank you, everyone. Thank you so much for your patient listening. Thank you, Dr. Mohan. Thank you, everyone. Thank you so much.
Good night.
Thank you.
Good night. Bye-bye.
Good night.